Hello all, I'm Dr. Neema Bhat, hematologist, BMT physician and pediatric oncologist. May May month of every year is celebrated as World Thalassemia Awareness Month. Specifically 2022, we celebrate World Thalassemia Awareness Day on May 8th, which is a Sunday. So on this particular day, I would just like to probably raise awareness about this disease called thalassemia, which India is considered the thalassemia capital of the world, by touching upon a few points. What do you do when, as a set of parents, your child is diagnosed with a disease called thalassemia? First and foremost, first thing to remember is this is not a very rare disorder. This is a fairly common disorder. It's a genetic disease that comes from a child being born to both parents having the thalassemia trait. So if the father and the mother of a child both have thalassemia trait, they have about a 25% chance that they may have a child with thalassemia major. So what is this disease thalassemia major? It's a genetic disorder which comes in different types. It can be alpha thalassemia or beta thalassemia. The one that is mostly a long-term disease or requires regular care is this disease called beta thalassemia. So it is a disease where children usually are the ones who are diagnosed with it under the age of 2 years. But even older children up to the age of around 8 or 10 years can also be diagnosed with a separate type of condition called thalassemia intermedia. But these children mainly present with signs of weakness. So they may not be as active as their peers. They may have low hemoglobin levels. They look paler compared to other children of their age group. They will have distended bellies or abdomen. So they have a large abdomen because of enlargement of organs called liver and spleen. They require to be diagnosed at the right time, because if we have a deficiency of hemoglobin in our body, which is usually what anemia is, then it is very difficult to continue life sustainably, especially for these kids, because it affects their cognitive behavior, it affects their development, it affects their performance, and of course their physical activity. So these children have to be diagnosed at the right time point by a pediatrician or a hematologist with the right kind of blood tests and, if required, genetic tests. Once they are diagnosed, they need to go on what we call a regular transfusion regimen, where these children most often start off with transfusions once every month. And then as they grow older and their blood requirement increases, they may require blood transfusions as often as once every 10 days to 2 weeks or even 3 weeks. With blood transfusions come side effects or deleterious effects like maybe transfusion-related infections. It can be iron overload related to transfusions. It can be transfusion reactions. So it's important for these children to be managed at centers that are specialized for thalassemia, for blood transfusion in thalassemia, and for them to be started on medications called chelating agents. So as soon as a child is diagnosed, or there is a suspicion of thalassemia diagnosis in a child, it is important for them to be taken to the right center, which is equipped with diagnosing the disease in the right manner and also setting up a protocol for treatment for this disease, so that the disease and the children are managed in the appropriate manner. Is there any cure for this disease called thalassemia? Of course, it's a lifelong disease where the individual will require blood transfusions almost once every 3 weeks to a month for as long as they're alive, and also these medications to keep their iron levels under check for as long as they are continuing to receive blood transfusions. And the only available cure that has been tried and tested for the last few decades is this procedure called bone marrow transplantation, where we put the child through HLA typing, which is nothing but a small test we conduct by getting samples from the cheek of the patient and from other family members. And whenever there is an HLA match donor, we take bone marrow or stem cells from the donor and give it to the patient after giving them medicines to empty their bone marrow. So we sort of eliminate their diseased bone marrow and give fresh marrow from the HLA match donor. That is called a bone marrow transplantation or a stem cell transplantation. There are, of course, newer therapies that are emerging, something that's called gene therapy, where we sort of take cells from the patient who's suffering from thalassemia out of their body and introduce this gene that they are missing, which is required for hemoglobin production, which is causing them to have thalassemia. And after introduction of the gene, we give these cells back to the patient so that they are cured of the disease. Although there is a lot of excitement around this new therapy called gene therapy, It has mostly been tried and tested in some of the European countries and in the United States of America. And there are a few centers only that have the privilege of using this therapy right now. And the long-term effects of this therapy are still yet to be studied in a large number of patients, before which I would probably not recommend it's safe for the general population. So what is the take-home message for the day, considering Thalassemia Awareness Month or Day is just around the corner? There's no need for panic for parents who have a child with a diagnosis of thalassemia. Make sure the child is taken to a center and treated by a physician who has knowledge and experience treating children with thalassemia, and that they are put on the right transfusion protocol, and that they're started on chelation therapies, and you also explore the options available for curing or treating this disease. If you have any questions or queries regarding thalassemia, please feel free to reach out to Dr. Neema Bhat, Hematologist. I also consult at Helios Cancer and Hematology Clinics. Thank you.